I hope y'all are doing great today. I know I'm having a good time. I'm really thankful to be here with y'all, and I'm excited to share all my projects. To get started, my name is William Coles. I'm from Mandeville, Louisiana. I'm a sophomore studying mechanical and electrical engineering at LSU, and I created Vector Coach. So let's start with the problem. Louisiana has a strong sports culture, but it comes with a hidden cost, which is ACL injuries, especially among youth athletes. As you can see from the chart, ACL injury rates among high school athletes have been steadily increasing over the past decade, especially in female athletes. And this is due to a multitude of factors. I decided to focus on three that I think we have the most power to affect. So many young athletes lack awareness of what safe movement mechanics really look and feel like, and they mostly rely on their coaches to show them this. But I've been around high school coaches my whole life. They're stretched too thin. They don't have the time, knowledge, or experience to act as trainers, no matter how many tools you give them that focus on coaching and winning games. And also many, like they showed the map earlier, the healthcare map, most parishes in Louisiana, the athletes there lack access to quality sports medicine centers for prehab and rehab care, whether it's because of money reasons or geographical reasons. There's a lack of access there. And the result is a system where preventable injuries end up sidelining athletes for months or even ending their careers. And Vector Coach is the solution. Vector Coach is a web platform that takes simple phone videos and delivers targeted, evidence-based prehab training plans. And this part I'm actually kind of surprised about how it's unique so far. I'm the only one I've seen so far, I might miss one, where it takes videos from the front and from the side. And the two movements that we focus on are drop jumps and single leg squats, just like foundational athletic movements that really give you insight into the specific sports movements that they are doing. And so the algorithm, it uses MediaPipe like a lot of the other ones. It analyzes different deficiencies that you might have that contribute to ACL risk. And then it uses Gemini 2.5 Flash to optimize the plans for each athlete's specific goals, time constraints, past injuries, and access to equipment. And then the result is an 8-week training program that helps correct those biomechanical weaknesses. And that doesn't only decrease ACL risk, it also increases performance on the field. And Vector Coach expands access to injury prevention tools for athletes in rural and underserved Louisiana communities completely for free. So Vector Coach isn't just, it has a lot of medical backing. It's not just like some algorithm. I actually spent most of the time building up that medical science like foundation and getting a lot of it to train the Gemini algorithm. So as you can see, most ACL tears result from dynamic knee valgus like everyone's been talking about, and valgus angles above 15% significantly increase ACL strain, and poor hip stability and trunk control can amplify torque on the knee and raise your risk. And female athletes, like everyone said, they face way more risk due to anatomical and neuromuscular differences. And there's evidence that says that neuromuscular retraining can reduce valgus, can decrease ACL injury rates by up to 50%. And then so Vector Coach uses MediaPipe to quantify these proven risk factors automatically using computer vision. And what really sets Vector Coach apart from the other entries is that a lot of those are very like AI forward. We purposely only use AI for the plan generation so that we can have it successful at scale. The actual algorithm that gives you the risk assessment dashboard it has dynamic thresholds based on your demographic information that you put in, but most of that is hard coded and doesn't use a lot of GPUs, a lot of processing power, because I want to be able to expand access. I don't have the money to pay for AI servers for every athlete in Louisiana, but just hosting a website is way cheaper. So this really expands access in that sense. And the only way that AI is actually used is the chatbot to create the plan. And using a chatbot to create a plan is way less, it costs a lot less money for the computer power than actually analyzing videos with AI algorithm. So that means that I can subsidize it. I can like spread it to all the athletes without having to charge them for it. I made a quick demo for you. The actual demo is supposed to be 7 or 10 minutes long, so I had to fast forward and cut out a few more boring parts. stay up and watch the whole thing. So during account setup, it collects demographic information like age, sex, height, weight, and sport, and uses this to adjust the dynamic thresholds during the risk assessment process. Like for women, the valgus angles are different just because of anatomical differences. And then right here, just telling the athletes like which movements they need to do, or the basic assessment. You just go through, you upload all your videos, you can use any camera, anything. And you can see once you upload it, they have a quality checklist. That checks to make sure you have enough FPS, you're really centered in the frame, it's good quality. And then, so you have the two main movements, drop jump and single leg squat, and you upload them with the front video and the side video. So that way you can build an actual 3D model. If you only have a front view, no matter how good the algorithm is, it only has a front view and you can't build an accurate 3D model from it. And that's what it needs to be able to accurately track all your joints. So that's a simple traffic light assessment. As you can see, mine wasn't too great. It's been a while since I've been training. And then so that's the Performance Center, and now that's the Gemini 2.5 Flash chatbot. They're just going back and forth, talking about what gym equipment you have, how much time you can dedicate to it, because this isn't people's whole lives. And then you also talk about your injury history, anything else that's relevant. Then once they'll propose a training plan for you. Y'all can have a conversation, and once you agree on one, you can click Finalize Plan, and it shows up in the Performance Center. And the plans are structured, so it's an 8-week plan, and you reassess at the end. And the plan is broken up into 2-week blocks. And each block has a certain goal, whether it's increasing strength or just like being able to walk again, or whether you've gotten injured or whatever it is. Each block is a specific goal that you're working towards, and it gives you, just take a second. Yeah, has an overview at the top. Each training block has specific workouts, and it explains how to do every exercise at the bottom. So my why. I think what sets me apart from the other competitors is that I've been in this situation. I didn't tear my ACL, but I tore my meniscus in my right knee in my senior year of wrestling. And then I had another partial tear in my left knee later on. And then right before state championship, I had a UCL sprain. So just senior year was not great injury-wise. So I've been there. And also I've met a lot of other athletes. A lot of the dashboards were awesome. I tried doing that at first. But then I talked to some of my friends from high school, and they were like, I don't know what any of that means. I only know it's on the mat, and you're showing me confidence scores, and I just don't know what to do with that. I want it simple. So that's why I decided to do the traffic light indicators. Just more about my story. In high school, one of the biggest things was team culture, and it was really just like a tough it out, rub some dirt on it mindset. And so we didn't go to trainers as much as we should have. And so injuries just got worse, and we didn't correct them before they happened. And I'm really focusing on making things proactive, not reactive. Because it's all great to heal from the injury fast, but it would be 1,000 times better to not get it in the first place. So that's what I was trying to focus on with this. Also, my goal, there's a reason I didn't try to incorporate doctors and physical therapists yet, is because with healthcare right now, that is the bottleneck for a lot of students. If you incorporate any medical professionals, it's almost definitely going to cost them money, and that's going to deter them because everyone thinks, oh, ACL injury isn't going to be me, and then it is, and then you're working on rehab. This isn't perfect, but by making it free for the user, they're more likely to do something proactive and not just wait till they're injured. And even if it's an imperfect product, it's better than just waiting until something happens to you. So my goal is to expand to other areas like strength and sports movements. Maybe video your back squat from the side, and it gives you tips for how to do better at your next powerlifting meet. And also full team integration like a lot of people had. A coach's dashboard. And that's where I would think the money would really come in, is you're pitching it to the coach for how much money they can save on trainers, and if they're losing NIL money because their star athlete gets hurt. But really the long-term vision is I just want to make Vector Coach a statewide standard for accessible, data-driven injury prevention and athletic performance. That's it.